Well, good afternoon, everybody, and thank you for joining us. Happy Friday the 13th. This is the CAF COVID Weekly Roundup. Today, we're going to cover a few AFLs that came out since last week. We'll talk about resource requesting. We talked about the new process with Salesforce for resource requesting. We're going to do a little bit deeper dive of that, and we have a couple of guest speakers that are going to join us to talk about the process. We're also going to talk about NHSN reporting, both for antigen testing devices as well as just the normal daily reporting. And then we'll talk about testing considerations with the increased community spread and what that means for facilities within the state. My name is Jason Belden. I'm the Director of Emergency Preparedness with CAF. Today, my guest speakers are going to be Patty Owens, CAF's Director of Regulatory Affairs. She's going to join us towards the end of the presentation. And with me is William Johnson from CDPH and Eric Scully from Four Leaf Partners. William Johnson and Eric Scully are going to talk in depth about the resource requesting process. And this is important because we're not out of the woods with PPE. We're not out of the woods with staff. A lot of things, not just now, but for in perpetuity, this is going to be the process that we're going to use to request resources. So it's important to understand this process, guys. All right, so let's get to the first of the AFLs that came out this week. Oh, I'm sorry, I didn't do our normal introduction. Today, the speakers' opinions are expressed are their own. They may not reflect CAF's official position. And where I differ from an official CAF position, and I say my personal opinion, I will state that on the webinar. This is a grant-funded program. It's funded by grants through the Department of Public Health, as well as the Los Angeles EMS agency. I personally have no financial conflicts. I know Eric Scully is paid by Four Leaf Partners, and they're an NGO as well as CAF. And William Johnson works for the California Department of Public Health. The intent of the webinars is to give you a situational report of the previous week, what has changed in terms of regulations. We'll mix in some forecasting for what the coming week holds, and we'll talk about best practices where we've identified those. So with that, I want to just start with probably the biggest AFL that came out. More was a clarification or really talked about in detail what the role of the IP is and how many people can share that role. And we had originally talked that it wasn't super clear as to whether the role could be shared with many people, 2 people, or 1 person. This is codified that and put it into language. So the full-time IP role needs to be shared by 2 staff members at most. And so, and I believe that CDPH has said this on the calls earlier this week. So hopefully you guys are understanding this. Whenever you calculate the hours for how you do this, they have to total 4, and it can't be more than 2 employees that fit this category. How you divide those hours up, I think is pretty flexible. Now you can use full-time staff and have a part of their work be IP, or you can hire an IP exclusively. That's up to you. But the IP, we talked about this, and we mentioned this on the call that the IP said, or it says in the AFL that the IP must be a registered nurse or licensed vocational nurse. We had originally thought that there were other qualifications that could qualify for that. So we're hoping for clarification from CDPH on that. I know that Heidi Steinecker answered this question on the webinar and said that it wasn't just exclusive to those specific folks. But the important part here, I don't want to bury the lead, is the IP hours cannot be included in 3.5 for direct care service hours. And that's a real issue for us, and certainly we're trying to address it with CDPH now. I don't want to belabor this. We talked about it at length last week, and we'll continue to talk about it as we go on. But we have a really short amount of time to get these folks trained and go through the process. So no time like the present to get started on that education for them. And then the second one This one is really important for your operational folks, especially when we talk about visitation. And I want to point this out because this was not originally a part of the AFL 22.5. And so they added this attachment to the AFL, and the attachment is a great graphic that tells you, based on community spread, kind of what are the considerations and actions you need to take for visitation. And if we have time at the end of the webinar, what I'd like to do is I'm going to actually pull up a version of that fact sheet so that we can look at the kind of the categories as it goes through, and you guys can ask questions with it on the screen here. So we'll get to that in a second. So with that, I want to talk about resource requesting and really kind of emphasize the importance of being able to understand this process, because I get many calls still frequently about providers seeking resources, and they've had less than good luck in purchasing enough masks to be able to meet their needs, purchasing enough gowns, all those things. If you got to the end of your rope and you have literally expired every resource that you can think of to get these resources, there is help available. Now, I don't want to say the cupboard is full and there's tens of millions of resources out there for you to access, but we have to be able to utilize this process to be able to get in there and let folks know, gosh, you know, I need 1,000 N95s and I need them, you know, on what date, you know, kind of think about when you're going to need these things and all that. So I want to turn it over to Eric Scully and William Johnson to talk about the process, because this is different than how we've traditionally requested resources from the MOOCs, but I think it promises to be a much more streamlined process, and it allows both the MOOC, but also the operational area or the region and the state to be able to see these resource requests come in so they can monitor and manage the resources more effectively. So it's really, I think it's important, and in the grand scheme of things, it will help us kind of organize response to these large events. So with that, I want to thank Eric and William for joining us. Eric, why don't you go ahead and take us through this slide, and then we can switch screens if you want to give us a demonstration.
Absolutely, Jason. Can you hear me okay?
Sure can, thank you.
All right, great. I apologize if there's a little background noise. We are in the Operations Center, so I'll jump into this slide and kind of walk through these steps, Jason, and then I can flip over to Salesforce and show you what it looks like, and I can walk us all through that. So the first thing here, the URL is pasted right here. That's the https://caloes.force.com. So if you go to that site, that's where you'll be prompted to either log in or sign up if you're not a member. So I'll walk us all through that sign up process, as most of you on the call are likely brand new to the portal and potentially even Salesforce. You will enter in various information unique to yourself and the entity that you're registering under. We have the ability to search for licensed facilities throughout the state. So again, I'll show you more of this live. And then we'll talk about how your user registration request is submitted, reviewed by the Medical Health Operational Area Coordinator to provide you access to the system. And then from there, what it looks like to actually submit these resource requests in an online web form. And back to Jason's point, hopefully making things easier on you and opening the accessibility to many different users with different experience with computers and technology. So. William, anything you'd like to add to this?
Thank you, Eric. So where we were 8 months ago with resource requesting was you would send an email to your MOOC, your Medical Health Operational Area Coordinator, and your Medical Health Operational Coordinator would say, yes, I'll try to get those resources for you, and then you wouldn't hear back. This new Salesforce thing would give you situational awareness. It would let you know that the MOOC has approved it, where it's at regionally, if they're going to find it within your county or within the region or at the state level. It gives you that overall 24/7 situational awareness on the status of your resource requests. With that being said, I'll turn it back over to Eric.
Okay, thank you, Will. And then one important point, if you're taking note of the screen here, there is a phone number that's been posted there and a Salesforce support email. So if you're getting into the system, you run into some issues, you might want to note down that email. And then I can also show you within the system how you can actually contact support. But in case you wanted the email, it's right there on your screen. Okay, Jason, I can now jump into Salesforce if we'd like. I can share my screen. Okay, you should be seeing Salesforce, and I'm actually going to go out and show you all what it would look like to go to that https // Now, I am working in a development test environment, so this is not the production environment, but is a almost identical replica to it. So you will arrive and it will look, again, identical to this when you go to the production URL. And if you're a returning user, you can go ahead and enter your email address and password, and that'll take you straight into the portal when you hit the login button. In this case, as many of you on the phone likely do not have an account, you will hit the sign up button, and that's right here located at the center of this pane. So when you click on the sign up button, you'll be prompted with a new screen here, and these are the core fields that we'd like to capture. So I'm going to go ahead and put my name here. I'm going to put in an email. I'll put in my phone number here, again, just putting in some test data for the purpose of this demonstration. And this is the important piece, is selecting your entity type. For this audience on the phone, we'll be navigating to the non-governmental entity for the entity type. There are several others, but again, for this call and this audience, this is where we would like to be, and that's the non-governmental entity type. When you click that, a dynamic field will show, and this is a required field to indicate what type of entity. So in this case, we would all be selecting the healthcare facility entity type. This list may grow in the future, but once you have your account set up once, you'll be all set. So I'll click on healthcare facility. And then you'll notice again, more dynamic fields are populating. So if you wanted, you could go ahead and start typing in information, your facility name, ID, address information, and then hit sign up. One thing we've actually added is a sort of lookup. So for the purposes of this demonstration, I'll be working out of the Alameda operational area. When I type my county, I can see a list of licensed facilities within Alameda County, or Alameda in the name itself. Alternatively, if you knew your facility number by heart, for example, so let's say 6300 16 137, and as I type, you'll see the list will get smaller, smaller, until you finally arrive at your facility type. So once again, I'll just search Alameda. I'll scroll down to one that at the bottom of the list here. Let's go with the Windsor Healthcare Center of Oakland. Now, one of the benefits of selecting from the predefined list is we have all of this information already populated in the system, and make sure you get associated and tied to the appropriate facility for your orders, and that impacts which MOOC reviews and approves your orders depending on which county your facility is within. So with that, I'm going to go ahead and select sign up. An email will be fired off to your email. So on my other screen here, I'm just standing by waiting for my email to come through. And there it is. So I'll go ahead and pull up that email just to show you all what this looks like. You'll get a link. You'll want to click on that. And then from there, you will be prompted to enter your password. Now, one important thing we did not have on the slide deck, but for those of you that use different browsers, Google Chrome, Microsoft Edge, Safari, and Firefox are all approved. We have experienced issues, and it's not a supported browser with Internet Explorer. So if you're defaulting to Internet Explorer, something very important to note, it is not a supported browser. Okay, so I'll go ahead and enter my password right here. And I'll go ahead and hit submit. And my password was successfully set. So now the system will take me into the center portal. Once you have an account and you sign in from that caloes.force.com, you will arrive at your center portal. Now, at this point, there are two icons or applications on the home page. We're focusing here on public health ordering system. So again, in the future, additional applications may become visible, but really what we're all looking at is the public health ordering system. And there's one action that can be taken at this point. As a brand new user to the portal, I can click register for app. It will launch a pane which presents my information to me and indicates that this will be sent to the Alameda MOOC for review upon clicking registration. So I'll click register, and now my request has been sent off to the MOOC, and you'll see that I am now in a pending approval status. I cannot get into the public health ordering system until my account has been approved. Okay, so in the background on my screen, I'm going to go ahead and log in as effectively the MOOC and approve this. But while I'm here, Jason, have we received any questions?
Yeah, we have questions, but nothing on the resource requesting so far. So.
Okay, excellent. All right. So in the background here, just so you all know what I'm doing, I have received a user registration request for Alameda County. I have the address information here. I'm going to go ahead and approve this and say approved, good to go. And then next, and that approval has been sent. Okay. Now, if I go ahead and refresh my screen, again, now I'm logged in as the healthcare facility. Oh, I have a new button here, go to app. So where it formerly said register for app and then said pending approval, now says go to app. And from here on out, I will be able to get into the public health ordering system. Okay, so now that I'm in the system, a couple of things to orient you. We've exposed a few tiles here. There are reports, there are user registration requests, and the resource request orders. And that's really where we are focused, is the resource request orders. So I also mentioned the Salesforce.support email. If you click on the contact support button, you will actually be taken to a page where you can upload a file or log a ticket right here directly within the application if you chose not to email the support. I'm going to jump into the resource request orders tab. By default, I have my recently viewed orders, but again, as a brand new user to the system, I wouldn't have any. Tip for you, if you'd like to hit this drop down and go to all orders and pin that tab, what that does is anytime I go to my orders page from here on out, this is the page I'll see. And when you start to have a bunch of orders over time, sometimes it's nice to see all orders instead of those that were just recently viewed in the past couple of days. All right, so from here, I'm going to go ahead and hit new in the upper right corner of your screen. And this is going to take us into the web form resource request form. So when we talked about looking to streamline, make things easier, more intuitive, this is effectively what we've done is transitioned from that Excel workbook version of the resource request form into a web form. There are some advantages to using a web form. Number one, it makes reporting quite a bit easier, both for the healthcare facilities, but also the MOOCs, the RDMHSs, and of course, the state of California. So I'm gonna go ahead and enter some data in here. I have COVID-19 as my incident. If I have any local or facility level, in this case, tracking number, I can enter that. What is the priority of my request? You'll see that my information has come over from my account automatically here. I may be the hospital administrator. My county's defined, my agency's defined, industry. Most of us here on the call will be working within public health, but there are other options. As far as delivery information goes, if there's a contact, you're the same contact that's asking for the product, we have a quick shortcut here to do same as above and bring that down. In this case, the delivery recipient entity name will be the Windsor Healthcare Center of Oakland. If there's any delivery notes, so for example, large campus, keep an eye out for the guard station, please drop at loading dock C. Okay, And then here we have the ability to actually search for an address. So in this case, I'll start typing 3650 Schriever in Mather, California. Here I am. Oh, yep, that's the building I've got. Perfect. So from here, I can go ahead and hit next. And I'm on to the second page of my resource request form. And this is where we're really getting down to the product. So the last page was all about the information of who's asking for it, where is it going. And this is all about what exactly the products are going to be requested. So I'm going to select supplies and equipment. I could also select personnel. In this case, I'll just stick to supplies and equipment. I can type in the type of product I'd like. So in this case, if I type in N95, I don't have a specific model in mind. That will populate there. I can go ahead and put in the quantity requested. So in this case, 1,000 N95s, and I can indicate if substitutes are okay. And then something we've done is we have the ability to add or remove rows. So for example, you need N95s, but you also need surgical masks. Maybe you need 2,000 surgical masks. If available, 3 ply. And substitutes in this case maybe not be okay. Okay. Some of the other fields we have here, so describing the mission and tasks. So this is facial protective equipment for medical personnel. Excuse my typos here. Actions taken on this request thus far. So this is really important, especially in the review and triage by both the counties, the regions, and the state, is we want to understand what is kind of the origin of this request. And we have exhausted all available avenues for PPE. All suppliers are out of supply. So just giving a quick high-level summary there, but you're welcome to put additional detail there. We have some additional checkboxes related to the RDMHC program and the EOM, so indicating that yes, we verified that and confirmed it. And then finally, I'll hit next, and this is sort of your final review page. So the information we entered on these first 2 tabs, the incident information, the requester information, delivery information, and my order information is all right here for a once over before we hit send. And from there, I'll finally hit submit. You'll see that a unique order has been created right here, this green bar, and it takes me automatically to the detail page. So when Will was talking about that situational awareness and kind of giving you visibility, you can now come back to this order at any time. If I go home, for example, and I want to take a look at my resource request orders, here it is. Right here, I can jump back in. I can actually follow along as it goes down its journey through the county to the region and through the state's various statuses until it's finally either unfilled and referred elsewhere, partially filled, referred elsewhere, unfilled and closed, partially filled, closed, canceled, denied, and fulfilled, closed. Okay, so a lot of information available. Again, this is the information that you entered in a slightly different look and feel. We have the ability to attach documents. So for example, I'm going to go ahead and grab a document just to show you what this looks like. If I drag this little box over here, I may have a picture of Gavin in this case. So I'm going to go ahead and upload files, drag it right in there. And now I can access that picture within my order, and the counties and the region and the state will all be able to go in and take a look at whatever supplemental file you may have uploaded as it pertains to this order. Okay. One additional feature I will expose, this is kind of a bonus or an add-on for those of you that maybe have used the system or are interested in it. We have included the ability to use chatter. And what this will mean is depending on which county or facility is within, you'll be able to chat with your MOOC in context of your order. So in the case of Alameda, and I apologize, I'm blanking on the name of the MOOC for Alameda, but I have a limited set of users that I can actually tag. So in this case, as a facility, I can only tag my MOOC. Otherwise, you're able to just post whatever you'd like. Please treat this resource request as urgent. And by sharing that within the order, the MOOC will be able to see this, the RDMHS would be able to see that, and the state would be able to see that. So sort of putting additional history within the order itself on that chatter tab. So I just wanted to show you that. It's a way, an additional way to sort of communicate within context of your order instead of sending emails or phone calls and things like that. So with that, Jason, I took maybe a little bit longer than I would have liked, but I hope that was comprehensive and helped walk through the registration and the resource request process.
No, that was fantastic. Thank you very much. We do have a couple of questions. One of which I can pose to you and William, although I think I know the answer. But does this resource request also apply to other MOOC requests outside of COVID, or is this COVID specific? And I think the answer is yes, but I'll let William say yes too, just so we get official confirmation.
Sorry, I was trying to figure out the unmute button. But no, this is not exclusive to the COVID. This is for fire, earthquake, PSPSs, any kind of disaster that happens.
Perfect. Thank you. All right. And we had another question, and this is related to it, but can this website, or should this website and login procedures be included in our main EOP in addition to the mitigation plan? And I'm going to say yes, you should, if you're going to utilize this. If you're going to point towards the process of requesting resources in your EOP or mitigation plan, then you need to have whatever link it is and whatever website that you're going to use kind of listed out in the plan itself. So those are great questions. All right, I'm going to swap the screens back here to Jamie, and I want to say thank you very much, Eric and William. You guys have made this incredibly easy for us, to figure out. So
happy to help. Thank you, Jason.
Sure.
Thanks, Jason.
All right, so as soon as I finish figure out the technology of getting the screen back to myself here. Look at that. Fantastic. Okay. So we'll hop to the next slide. Give me a second here. All right. Oh, there we go. All right. Now, has Patty joined us? Hey, Patty. I think you're on mute.
Can you hear me?
Yep, we can hear you now.
All right.
So Patty's going to give us kind of an update on this NHSN point of care antigen testing reporting, as well as talk about reporting in general. Please take it away, Patty. I don't want to get this one wrong.
Okay. So as we all know, CAF has messaged this out on the forum, and I'm just getting into a place where my phone isn't going to work. So don't you just love technology? So, alrighty. So we've sought some clarification from CDPH, but we're now required for having the point of care testing devices to be reported into the NHSN system. So it's kind of going to be a duplicate reporting. So you're also going to do your CLIA reporting, and then you're going to do the reporting into NHSN. And you gotta, this is going to get weaponized on 11/20. They'll start looking at it for regulatory compliance. So you want to start now. Now the clarification we did seek was, some facilities have conferred their rights over to CDPH with their daily reporting to report for them to NHSN. Unfortunately, that will not go over. So even if you've conferred your rights over to CDPH, you have to go in and separately and report in NHSN, specifically if you're using point of care devices. So I'm not sure how much of the membership that's going to affect or not. And then the second thing, you must have your SAMS level 3. You have to register and get SAM level 3 clearance. And there's a few little snafus in there. When you're trying to do that, there is the issue of making sure that your what is it? Your CLIA ID number is correct. The administrative user is correctly in there. So you really want to double check the information when you're upgrading to your level 3 because there's been issues with that. Deanne or Jason, do you have anything to add in on this?
Well, I just wanted to point out, so for the attendees, if you look over in the handouts, AHCA put out a guidance on how to sign up and get your SAMS level 3. I put the bullet points from the handout on the slides here. So, but for you guys that are on the phone or something like that, if you need a copy of the handout, if you called into the webinar, just email us. I know Patty included it with the CAF form information. So the information is out there on how to get the SAMS level 3. If you have questions about it, don't hesitate to reach out to us, but I don't really have anything else. I did have one question, Patty, and I don't, and this is probably going to be a common one, and I don't know if we know the answer, but I'll ask you, and then we can kind of talk through it. But
can I, Jason, are you there?
Yeah.
Oh,
yeah,
I was
sure.
just going to clarify one other thing before the question, if that's okay. There's also the reason we have to report the ones that have conferred rights over to CDPH. You need to directly report into NHSN because my conversations last night with CDPH, they are in the process of working in the background of NHSN pulling the information to cover the CLIA waiver required reporting. So right now it is duplicative, but something soon should be issued soon on how they're going to. You'll just have to put it in one place instead of two. So go ahead with the question, Jason.
Okay, can you hear me now? Sorry, my mute button was not working for some reason. Okay, so the question was, if somebody is not going to do antigen testing and they're not going to use the POC instrument, do they need to upgrade to the SAMS level 3 in order to report their NHSN data?
My understanding is no. This is strictly for the people using the point of care testing antigen devices that are actually using them.
Okay, perfect. All right. Let me see if I've got another question about this. If not, we can hold the remainder of the questions until the end here. But yeah, a lot of them are talking about how they have not got or they're waiting to get their SAMS level 3. We understand, and correct me if I'm wrong, Patty, but I think it's 3 to 4 weeks at minimum to get
Yes.
the card. Is that correct?
It is correct, and it may be as far as 5 weeks. So what you need to do is you need to really document your due diligence, your good faith efforts to be in compliance with this new requirement. So just keep your emails, keep your correspondence, show your evidence that what you've done to get signed up and be in compliance with this reporting, and that should get you through if any regulatory issues come up.
Perfect. Thank you. All right, so we'll hop to the next slide. Give me a second here. Oh, whoops, one more slide. There we go. So many of you guys have seen it in the news or have heard about increased community spread, and either that or you're not watching the news. But there's definitely an increase in the number of cases, both here in the state and then obviously in other portions of the country are profoundly affected by this now. I want to say this because I know there's a general fatigue that's going on with our staff, with our ability to maintain consistency with infection prevention kind of goals and guidance. It's really difficult, but it is true that generally when we see increased community spread, we see increased spread within skilled nursing facilities, and that's just the nature of COVID. If you've had an outbreak in your facility, it does not mean that you won't have another outbreak in your facility. If you're in a county that has increasing community cases, the likelihood of it coming to your building is pretty high. And when I say high, it might be 20%, but still that's high. It is important for us to stay consistent with the application of all these infection prevention rules. It's not just now. This is going to be the way it is for a while. And I just wanted folks to know, I've had a lot of people reach out and go, well, how am I going to, I'm not an epidemiologist and I can't view all of these things to determine, when I should be worrying about increasing my testing or reducing my visitation, because all that is tied to the county positivity rate. Many of you guys don't know this, but there's something called the California Resiliency Alliance, and maybe I can do a screenshot and I'll show you guys what that looks like. But I've included a couple of handouts that show kind of nationwide, kind of the modeling forecast, as well as the state of California, as well as regions within the state. So you can look at kind of the trend line for your general area. None of them show, none of the models show decreases in cases or decreases in hospitalization. And I think that's important to understand that we're going to see probably increased spread within the community, and we're going to see more outbreaks within skilled nursing facilities. We know there's a number of those that are currently happening now, and unfortunately, they will probably continue to happen. So, yeah.
This is Patty. I wanted to add in right there real quick, if you don't mind, when we're talking about getting your SAMS level 3 to report for point of care device use. All along, as a statement from CAF, we've been advising everyone to do all the steps necessary to be using the point of care devices, because as things change, or as the winter comes, or as we get more high community spread, or we end up having to, kind of mitigate things ourselves, we are encouraging everyone to be prepared, even if you're not currently using the point of care device. But so for the question earlier, who should get the levels 3? And I really encourage, my personal opinion is encouraging everyone to go ahead and get the level 3 clearance, because it does take 5 weeks, because you don't know moving forward if you're going to want to switch to using the point of care devices or not. So I just wanted to add that little statement while you were talking about the community stuff.
Yeah, no, it's a great point, and one that we want to really encourage you guys. Even if you're not going to use them for screening, even if you go, I'd like to operationalize these things, but it's really onerous and it takes a lot of work to do all the reporting that goes with it. But if you think about it in terms of, especially if you're in a county that's in one of the lower tiers and you're full on doing inside visitation, I'm not under the assumption that we're not going to see outbreaks as a result of visitors in the building. We're going to see it. The question is, how good can we be at mitigating the impacts once it comes in? And some of that can be alleviated at the door by using these screening tests for the visitors. And I know it's not something that we had originally kind of thought about, but after hearing multiple situations where visitors have contributed to outbreaks within skilled nursing facilities, we know it's a possibility. So if you think about, gosh, I don't even want to do the SAMS level 3, one, we recommend just at least get the card and go through the process to make sure that you're prepared to have to go back to point of care testing if that's all that's available. But also, we don't know what the future holds. And next month, CDC could have some other requirement requiring a level 3 account. So once you have it, I think you're in, but the process to get in is pretty difficult. So we would just want you to go through that process and get folks signed up and ready to go for that. In terms of considerations, we put up the 2 websites that you should be checking to look at what your county positivity rate is. If you're not in Los Angeles County, you would use the top link, the covid19.ca.gov, Safer Economy. and that has every county. In Los Angeles County, they've specifically asked that you go to this dashboard, and that's linked up at the top, and that's the public health dashboard that's linked on their page. Just know that I had conversations with Los Angeles County yesterday, and if they go into the purple tier, regardless of whether they're over 10%, they're going to require twice weekly testing of all staff, as well as the continued testing of residents at 10% screening. As for other local health departments, we think that it's possible that they may follow suit with that. In the interim, we need to be prepared to get ready to test twice weekly if the increase in community spread raises these levels into the purple categories for your counties. In terms of considerations, I want to talk about the visitors. It's even if you're not don't have a process to test visitors as they come through the door, I think what I would do, especially if you have lots, a really robust visitor program, and you have lots of folks coming to visit, 6, 8, where you have lots of residents that have potential exposure risks from those visitors. I would consider, and definitely if you're in Los Angeles County, you're doing screening testing of residents anyways, might as well prioritize the residents that either A, leave the facility frequently, or B, have regular visits. I think to have that extra look at their exposure risk would probably be helpful, and it may nip in the bud some outbreaks that could occur from asymptomatic transmission of COVID. And then if you're still struggling with your lab resources, we listened to the folks on the call yesterday, and I'm going to join a health department call, a statewide health department call on Monday to talk about the state lab resources and how we access those. The guidance we've been given is to have you contact the local health department to access those resources. But as we get a more formalized version and something more formal in writing, we'll pass that out to you guys so you guys can utilize that process as well. All right. I want to, we're getting close to the end here. I want to finish just by mentioning something before we hop to questions. I want to, gosh, did I get out of the slideshow? I apologize. All right, so I want to just talk to you guys for a second about the CAF annual conference. Many of you guys go to the CAF annual conference every November down in Palm Springs, and gosh, don't we all wish we could be sitting by the pool in Palm Springs right now. But what we have done is we've had to adapt just like everybody else, and we've gone to a virtual convention. Now, normally it would not be a part of what I would promote on a disaster webinar, but the reason why I brought this up is because so many of the educational sessions are built around elements within your COVID-19 response, from reimbursement to operations to legal considerations, clinical, IP, you name it. There's a lot of education in there for you guys to increase your awareness around COVID and to kind of protect your ability to stay as a functional healthcare facility in perpetuity. There are lots of challenges that go with managing COVID. It's not just the infection prevention stuff. It's many, many other things. And so I wanted to make you guys aware of that. Most of these sessions are recorded, but we have live chat during the sessions. So I will be a chat monitor for many of the sessions. If you have questions, you're going to have a team of folks that will be able to answer those as you go through it. So that's my promotion for the CAF Virtual Convention. Hopefully we'll see you there and we can present to you. And now let's hop to questions. Actually, you know what? I was going to try to see if I could demonstrate that handout on my screen real quick. Let's see if I can. Jamie, can you switch to my screen, or can I switch it to my screen? Let me see here. All right.
Yep. Okay, perfect.
All right. So bear with me, guys. I want to show you the handout. All right, visitation fact sheet. So as we look at this, and this is in your handouts, guys, and certainly you can go to the state's website and download this yourself. But virtual visitation is required. That continues. Outdoor visitation must continue. The part where we have questions about is, where is it indoor visitation? What is it tied to? And so I realized that Heidi made a distinction between in-room indoor visitation and in-room large communal indoor spaces. And so there, in the state's mind, there are two different differentiations between that. And so you should be allowing indoor visitation if you have a large communal indoor space, you know, plus you can maintain the infection prevention guidance, and you're in the red, orange, or yellow tiers. You don't have any staffing shortages, access to testing, all that good stuff. So that's pretty clear that they want indoor visitation if you have large communal space. My suggestion is, you know, if you can do it outside, I would do it outside until I can't do it outside. And then when I do it inside, then I would look at those spaces. If you're doing it outside and that's the safest manner, it's comfortable for your residents are okay with that, I would stick with that for as long as I could, as long as the weather would hold out. Simply because once we get inside, the transmission of COVID is much more likely in indoor enclosed spaces. And so to the extent we can minimize that, I would suggest doing that first. I know this says must. I really think it's a safety consideration. If you can do it, no, that's great. But there are a lot of considerations with those indoor spaces, and you got to be really, really comfortable with making sure that the space, the airflow, the 6-foot distancing is appropriate. The cleaning after the visitation, all that needs to occur. Professional visitation, so it talks about, you know, surveyors and ombudsmen and folks like that. And then the real issue here is compassionate care, because this applies to everybody. It doesn't matter if you're in a purple category. Compassionate care visitation must be permitted, and that's per CMS. And there's the categories in which compassionate care visits fall under. So those 4 bullet points, as well as personal contact, they must be screened for COVID-19 symptoms. They need to be routinely tested. They need to wear a surgical face mask, not a cloth face mask when they're building. They're restricted to the residence room, and obviously we're going to remind them to perform frequent hand hygiene. So I wanted to introduce this to you guys. You know, I give the state credit when they give us something that's really concise and helps us operationalize what they want. So this is great. All right, we're going to hop to the questions now. All right, give me a second here. All right, so I'm going to scroll back up to the top. And one of the first suggestions, and I thought this is a great one, and I'll see if I can find some subject matter expertise, whether it's on this webinar or not, but the question was, might CAF be talked into hosting a monthly IP roundtable via Zoom for folks to discuss new regs or best practices? And I think that's a fantastic idea. You guys let me know in the chat if you want me to get folks from the state to be on that, because I certainly can. I have a very good relationship with Vicki Keller, or I've developed one in the last few months, and she would be more than happy to come join us in our education. And she does a great job. She's very concise when she speaks. She talks to the surveyors that are out in your buildings once a week, so she has an understanding of what's going on in the field. If that is an example of somebody you'd like to have in there, as well as folks from industry that are working as consultants or things like that, we can bring all those folks in. And so if you don't want somebody from CDPH on that webinar, let me know. But if not, I think she's great because she has good practical experience to let us know. So great suggestion, something I will work on creating. I don't know if it'll be in this format or we'll do it in another webinar, but we'll arrange that and hold that probably It's probably going to be the beginning of December is my guess, because Thanksgiving's next week. And so I just want to say we're not going to have a webinar the day after Thanksgiving because I'm going to take a much needed vacation, and and so I'm going to go do that for a couple of days. I'm not going to be here that Friday. All right, last week I asked where CDPH was with the out on pass guidance, any updates? And yes, CDPH sent us a draft of the AFL that they're going to produce. And I know Patty and Deanne and Claire and a bunch of our staff are working on the guidance. We've all reviewed it. We've sent back our comments to CDPH, and we anticipate that guidance to probably come out next week. All right, next question. All right. Unfortunately, some communities are still waiting for their SAMS level 3. Yes. We still do PCR testing for all of our employees and residents. We do not use POC, although we have it available. Do we need to upgrade to SAMS level 3? Well, technically, no, you don't. Not to, if you're not using the POC, that, that's what the sign up is for. But hopefully we've encouraged you to at least build in your capacity to be able to use them, so that, if something happens and you absolutely need to use that point of care device, you have the ability to do the report, and you're not going to get cited for failure to report from the CLIA guidelines. All right, didn't the threshold for twice a week testing change to 8% from 2%? And it depends on the county in which you're in. So, CMS is pretty clear that it's, 5 to 10% is one, 5 to 10 is another, and above 10 is twice weekly. California in their AFL just says once a week, and they point to the CMS QSL, but they didn't actually list it in the thing. And I'll say that from my understanding is that the counties are probably going to require testing twice a week if you're in the purple category, which is the 8% and above. Do we have to report an antigen test if there is a PCR test that is done and reporting for the same day? And the answer is yes. Anytime you use the POC device, whatever the results of that test were, they need to be reported through the CLIA reporting process. If you've already signed up for the SAMS level 3, then you report it to NHSN. But until you get that level 3 sign up, you're going to have to continue to use the same CLIA reporting process. New admissions is tested through, and both are negative. Can I report only the PCR result? No, unfortunately, you've got to report them both. Where can I find the recording of previous webinars? So if you go to, this is an easy one. Let me pull up. There we go. So hopefully you can see that on my screen there. But on the CAF, on youtube.com, just type in CAF or CAF TV, and you can find a listing of all the recordings. There's a playlist for all of the disaster preparedness recordings. So if you want to just look at just these webinars, there's a playlist within the CAF webinar or the YouTube page. All right. All right, I think we're just about to the end here. All right. Regarding rehab in a yellow zone, can a patient do rehab outside of the room, such as in a therapy gym, if there are no other residents in the gym? And if it's a part of their patient care, then absolutely, you need to provide that, whatever that patient care is. Just know that they're in the yellow zone. That requires everybody that's within 6 feet or providing care to that resident needs full PPE, and that includes the rehab person. So when you think about the rehab person, has that person gone through the initial fit testing process? If not, we got to get them through the fit testing process. Do you have masks and gowns, and have you trained them how to don and doff, all that good stuff? So just know that yes, you can. If nobody else is in that area, you want to make sure that you have adequate air changes before you reoccupy that space, and do terminal cleaning for everywhere in that room that the resident could have touched. So a roundtable is a great idea for the IP folks via Zoom, especially helpful. Yes, I think folks like to see other people. I don't know why people want to see me, but I will. But I'll get other folks on the call. You just see me. I'm wearing a t-shirt and a hat. So Compassionate care visitation, they insist on touching and hugging, and at times they are not keeping their mask on. Any suggestion on families that don't want to be compliant with our policy? Well, the compassionate care visitation is a little bit different because it has said that they can touch their loved one. But in those compassionate care situations, hopefully we are requiring them to be tested. Now, if they're going to be tested, you know, through your process, you'll have a record of, you know, when they've been tested and everything. If they're going to their own medical provider to get that test, you want to make sure that you get some kind of feedback from them on what the result of the test was and when it was. So any suggestions on families that don't want to be compliant with our policy? I don't know. You know, with the compassionate care situation, it's allowed they touch, but absolutely they got to keep that mask on. And if they don't, you go, look, you know, we already think it's unsafe for you to be within a 6-foot circle of your loved one. You think it's important, and it's important to you. But that PPE is critical to protecting not just that person, but also other people within our building. So we absolutely rely on you to help us protect our residents and our other staff. So it's important that you wear that mask and you keep that mask on. So I think you can have that conversation, and some people are reasonable, but there are other people that are not. And for those that are not, you're going to just say, hey, listen, I'm going to have to ask you to leave. You can't do that. And I can't put other people at risk based on how you feel. So just for clarification, double masking is not allowed, right? And that's correct, yes. Can you clarify what is compassionate care? Well, gosh, you know, that's a real nebulous term, but in the guidance that CMS or that CDPH sent out in that attachment, that compassionate care is listed out. So there's specific bullet points that it has to meet in order for it to be compassionate care. If it does not meet those bullet points, it does not meet the definition for this particular AFL. So, all right, that is all the questions we have for today. I want to say thank you, everybody, for joining us. I know William and Eric both dropped off, but I thank them immensely. I can't tell you how different this is than the traditional resource requesting process. So much better, so much easier for you guys to be able to monitor and understand where your request is and when it's going to be fulfilled. So my hope is that you take this opportunity to go get signed up for that process. And if you have any questions, feel free to reach out to me or Patty, and we can get you connected to the folks at OES if you have problems getting set up with accounts. So I want to say thank you very much. Hopefully you have a wonderful weekend, guys. We will see you next Friday. Hopefully I'll talk to some of you at the conference Tuesday through Thursday of next week. And as a reminder, the Friday after Thanksgiving, we will not have a webinar. So thanks very much, guys. Have a great weekend. Talk to you later.